it would be helpful for me to provide a brief overview of what Loma Linda University Health is. That context is important to understand how we are utilizing the community engagement tool from Everbridge. So Loma Linda University Health was founded in 1905 as a private faith-based organization, and there's really two components to that. There's the medical side, and then there's the education side. And I'm first going to speak to the medical side. What started as a very small healthcare sanitarium, actually, and what was actually mostly orange groves in Southern California, has now become a tertiary care center with multiple hospitals. So under Loma Linda University Medical Center, we have the University Hospital, Adult Services, the Loma Linda University Children's Hospital, and that's what you see in the main picture to the right there. The main hospital was constructed in 1967, and we currently occupy that space there. Those round towers and the section to the right, that's the Adult Services Hospital. And then the square rectangular buildings to the left, that's our Children's Hospital there on the left there. We also have a Loma Linda University Medical Center East Campus, which is another inpatient facility, as well as our urgent care. We have a behavioral medicine center, and that is located actually almost 4 miles away. We also have the Loma Linda University Surgical Hospital, and we have another medical center in Murrieta, which is in a county just south of us, and so that's approximately 40 miles south of our main campus. We also have a number of clinics throughout the area. So we have a Highland Springs Medical Plaza that is about 25 miles away, and we're actually working on opening up another pediatric clinic, which is 70 miles to the east of us in Indio. Now, just for reference, Loma Linda University Health is located in Southern California. We are about 60 miles due east of downtown Los Angeles. So you can take Interstate 10 from Los Angeles and just drive straight through, and when you get the exit for Loma Linda, you're basically a mile away from our campus. So we're right there off of Interstate 10. So some key facts about our facility today. We are the only level 1 trauma center for the 4-county area of Southern California. That would be San Bernardino County, Riverside County, Inyo, and Mono County. So we essentially cover from the border of Los Angeles County all the way out to the state border of Nevada and Arizona on the eastern side. We employ over 13,000 people in our healthcare entities, and we have over 100,000 emergency department visits per year. Nearly 50,000 inpatient discharges per year, and 1.4 million outpatient visits per year. All of our facilities are combined on our main campus for a total of just over 1,000 beds. One of the things that's happening here on our campus is that we're actually building a new facility, a new hospital that we will be moving into in the year 2020. Due to seismic regulations in California, hospitals have to meet certain seismic code guidelines for structural integrity during and after a disaster. Unfortunately, the towers and the facility that were built in 1967 don't meet that. So we're actually currently under construction right now. And that area where you see our logo on that top picture, and just to the left of that, which is currently a parking lot in that picture, is actually a giant pit right now, and we are actually pouring the concrete today for parts of the foundation. And that will be a 17-story facility. It will be the heaviest high-rise facility east of the Mississippi. It is actually going to be a heavier building than the 70-story building that is under construction in downtown LA, and that's due to the seismic regulations. Over the next few years, we anticipate thousands of construction workers to be present each day once we undergo the actual raising of the tower with the steel beams and construction in that area. On the university side, which is also a component of Loma Linda University Health, we have many programs and many schools. We actually have 8 schools. We first admitted our first group of students in 1905 to our nursing program, and we have 8 schools mostly focused on healthcare. We are a health sciences university. We have a school of medicine, dentistry, pharmacy, nursing, behavioral health, public health, School of Allied Health Professions, and also School of Religion. And as I mentioned, we are a faith-based organization. Some key facts about our university: we have 132 degree and certificate programs, just under 4,500 students, and nearly 2,000 full-time and part-time faculty. That's not including our staff. So the picture on the top right is actually Nickel Hall, and that served as the original hospital. That building there was constructed in the 1930s, and then we moved into the main tower facility that we still reside in today in 1967. So we have a lot of older buildings as well as a lot of newer buildings. Below we have our newest academic building, which is our Centennial Complex, which houses our medical simulation center, as well as our basic anatomy lab for our School of Medicine, and a number of amphitheaters. There is a conference center on the top floor there, and so oftentimes we have visitors and guests who are utilizing this facility. That could be anything from community groups to alumni groups. One of the challenges that we have with Loma Linda University Health is that we are an open campus. Like I mentioned before, we have facilities throughout the community, and some of those are at a distance. So this is actually a picture just of our main campus, and then we have medical and educational facilities within about a 4-mile radius of this, reaching out into San Bernardino, which is the city of San Bernardino, as well as the city of Redlands in the local area here. So one of the things about our open campus is that it's not just our healthcare and our educational facilities that are sort of on our main campus. So I've actually circled in yellow, or in orange, the other facilities there, and working from left to right and from top to bottom, we actually have a motel that's right on our campus. There's also a number of food eateries. Cafe Society is just one example of that. We have Loma Linda University Church. We actually have 2 major churches on our campus. Loma Linda University Church is the largest church within our denomination, and we actually have over 7,000 members in that church there, and that's a third bubble from the left there. We also have Campus Hill Church. There's a barber shop, a shoe repair facility, travel agency, a real estate office, a clock and watch repair shop. We have one of the 2 major banks in town, so Bank of America is actually on our campus as well, a hair salon. We have a grocery store that's on our campus, the School of Medicine Alumni Association, a campus store which is actually run by Barnes & Noble, and also the Ronald McDonald House, which provides housing for patients, particularly pediatric patients that are receiving long-term cancer treatments here at our facility. So all told, we have a lot of entities or groups or stakeholders that are actually not part of Loma Linda University, but actually reside on our campus, and we have to take some responsibility and ownership for the presence of those individuals on our campus as well. So when we look at mass notification at Loma Linda University Health, this is a process that started about 10 years ago, and this is when I was working on the university side. I identified that we had some needs for notification of individuals in disasters through much of the committee work I was doing at the time on emergency management for our campus side. And the goal was to bring a mechanism to notify all of our students and our faculty and staff should we have an emergency or disaster, such as an active shooter or a bomb threat or a hazardous materials spill. One of the things I forgot to mention on the slide before is we actually have, on the northern border of our campus, main campus, we have the major east-west rail line between Los Angeles and Florida. And so we have thousands of tons of hazardous materials that are passing by us every day through the rail system there, as well as also on Interstate 10, which is about 1 mile north of our facility, our main campus. So given some of the local hazards we have, everything from being close to the city of San Bernardino, which has had some of the worst crime statistics throughout in the nation, we have our hazardous materials exposure to the rail lines and the major highway on Interstate 10, and just all the other myriad of things that many of you are familiar with that are potential threats to either healthcare facilities or to educational facilities. We really had the desire to be able to send out a message quickly. So we started that process about 10 years ago, and we ended up liking the solution so much that our administrator said, you know what, this isn't just an educational responsibility, this is an institution-wide responsibility. And so that was really just the tip of the iceberg as we started to understand what it meant to send out messages to a large population. With that goal of sending out one message, we started with the university. It reached out to the medical entities, and then as we started to look at how our campus is very open and we have a lot of different people on our campus, we also recognized we needed to be able to notify contractors and vendors who have long-term relationships with us. These could be registry nurses, these could be other people who don't really have a full-time employment through us, but are present on our campus, as well as the myriad of visitors we see. So within our mass notification system, which is Everbridge, we have over 22,000 contacts in our system, 16,852 are employees, 4,248 are students. Not every student opts in to our system, but in terms of enrollment into the system, we push 90% typically, because we have integrated the sign-up process into the registration process. So when they sign up for their classes every quarter, they actually have to go through and either enter their information in or decline to enter their contact information in. So unlike many schools out there, we actually have a very high participation rate within our emergency notification system. We have about 937 contacts within our satellite sites. Those may include clinics, but primarily that is our medical center down in southern Riverside County, about 40 miles away. So one of the challenges or the growing pains that we sort of had to encounter as we were building and rolling out our mass notification system is that we found that we had some very diverse audiences. The healthcare practitioners within our hospital, such as our nurses, are actually prohibited by policy from carrying a personal phone while they're on work because they don't want the employees checking their text messages and getting on their phones doing personal business. So our original plan of notifying people through, say, Everbridge through their personal devices actually didn't end up working out, and we needed to expand that to be able to notify people through other devices such as workstations. And so that really led us to the development of our current notification system solution, which we've branded LLUH Alerts. And really what we've done is we've recognized that it takes multiple strategies and multiple technologies in order to be able to accomplish our mass notification on our campus. So we branded it LLUH Alerts just because it is more than any individual technology. So for the medical staff within our hospitals who aren't able to carry a personal communication device, we've employed Alertus, which is a desktop notification service, and it actually provides a full screen message to all of our LLUH workstations. And it does it instantaneously and all at the same time. One of the beautiful things, though, is that it has full integration with Everbridge, so our security control center and our dispatch officers don't actually have to send out multiple alerts. They simply go into Everbridge and they initiate the alert, and the Alertus alert then tags off of the message that they're putting in for Everbridge for the mass notifications and the individual personal alerts. Once we put those two components together, though, we still had a gap, and that gap had to deal with the difference between our internal audience and constituents versus our external audience and constituents. I separate those two in terms of internal versus external because our employees, our students, these are people that our institution has decided that we want to manage and maintain the contact pathways. This includes their email, their institutional email, as well as actually soliciting personal emails, their phone for voice notification, a phone number for text notification, and all the paging devices within our communication system that we maintain. So those are people we have a lot of control over in terms of how we manage those numbers, how we manage those contact points, and who's in there. And we also end up assigning each of those people a unique identification number. But then when we talk about all of the other people on our open campus, such as our grocery store or through the Barnes & Noble bookstore, or even like the members of the University Church, which are here on weekends primarily, those are not people we actually want to have to maintain a lot of information on. We don't need to know their name. We don't want to have to assign and manage an ID number. We don't want to provide a lot of support for that. And so that we can find that those are our external audience and constituents, and because we don't want to manage their email, their phone numbers, we don't want to really have a lot of support costs with that. we needed an additional solution, and that's where community engagement came into play for us and was really, I think, the tipping point for us in terms of selecting a mass notification provider. The community engagement allows us to set up a text message alert that's an open subscription. So it essentially targets people that are not within your database for notification, but allows them then to sign up for notification when we have an event, and we can send select messages to them, or we can send the same messages that we are sending out to our own constituents. So we had to ask ourselves, when we realized what community engagement could do, we needed to figure out what our use case scenario was for that. And what's sort of interesting is, as we've moved through this process of rolling out community engagement, and we're still in the process of rolling this out right now, is that some of the stakeholders that we thought that we wanted to notify actually didn't work out, but we also found some unique use cases that we didn't originally anticipate using community engagement for, and we found that that actually works really well for us. So primarily because of our open campus, we have community stakeholders. These are the individuals who work on our central campus but are not our employees. We also have vendors and contractors because we are a very large healthcare facility. We have trucks and supplies coming here every single day, and many of those vendors actually deliver some of those things or maintain the equipment and supplies on our campus on a daily basis. These are people that we simply just can't enroll in our Everbridge notification system because we don't want to maintain the IT component on that. In addition to that, and there was some, to be honest, there were some cost elements to that. So most of you who are Everbridge customers know that with any mass notification system, the cost of your contract is contingent on the number of contacts that you have in your system. And so, if we were to do that, we'd double the cost of our base contract essentially if we wanted to add a lot of these community members to our system. So another unique group that we are targeting with our community engagement tool is the parents or family of students. During previous experiences of disasters or emergencies, we found that a lot of the parents are very anxious about what's happening on our campus or near our campus. One of those examples is the December 2, 2015 terrorist attack in San Bernardino. That occurred approximately 1 to 1.5 miles away from our main campus. And we were receiving a large influx of phone calls, both to our security dispatch center as well as to our administrative offices. People wanting to know what's happening on our campus. Are we under attack? Are our students safe? Are my kids safe? It's really challenging right now because we can't really provide them information about a particular student. So FERPA is federal laws that regulate privacy. This is very similar to HIPAA on the healthcare side. And so if somebody were to call in and say, is Jack Smith safe? He's my son. We can't actually even verify whether Jack Smith is a student within our organization because we're not supposed to release information about our students for privacy considerations. Not to mention, it's very hard to manage an emergency on campus when more than half of your call volume are people just wanting to inquire and get information about the event that's occurring. So we're actually opening up community engagement to the parents. We will be marketing this to them specifically, and we're hoping that they will sign up, and when we have events, we will be actually proactively informing them of the status of the campus, what's happening, and hopefully alleviating some of the load on our Security Control Center dispatch office. There are some special cases that we've identified where community engagement is also an important tool for us. This has to do with our Ronald McDonald House. Again, this is a fairly large residence for patients receiving long-term care within our hospital. Oftentimes these are cancer patients and they're typically pediatric patients. Because the kids and their families are living here, we want to be able to notify them about emergencies or disasters that are happening on our campus. Our foundation for our organization owns many properties throughout this area, throughout the Loma Linda area, and they rent those out to students, to residents to family members who are here on a short-term or long-term basis, sometimes due to treatment here at our facility. And those are also a target audience for notification with our community engagement tool. And then we also have regular outpatients. These are typically cancer treatment patients or perhaps dialysis patients. These are patients that are here on a weekly basis or even more frequently. And we separated actually our outpatients from our other patient populations, and I'll explain that later when I talk about the non-use. When we were working with Everbridge and reviewing contracts, our client advisor spoke highly of using community engagement for temporary events, and we sort of didn't take that seriously because that wasn't really our use case that we had in mind. But what we've actually found is that for our disaster drills and our disaster trainings, in particularly some of our mini drills, where we're walking into a department either on the university side or on the healthcare side, and we are working with a small group, typically anywhere between 15 to 100 people that we're training at one time, that community engagement is a really special tool. So we'd actually been conducting some of our Code Silver active shooter drills and trainings within our entities, and we do a briefing and then we do a simulation where we actually send a Confederate with a simulated handgun, and they're pursuing people within the facility and causing them to go down into their lockdown or their run, hide, fight protocol. And what was happening was that we do that only for about 10 minutes and then we call for debriefing. But some of the individuals who were part of the simulation had hidden themselves so thoroughly that even though we would go through the hallways with a bullhorn and say the drill's over, please meet at the debriefing room, they would stay locked down for the next 20 minutes, 30 minutes, and our debriefing room only had half the people that we were supposed to have for the debriefing. And that's because we told them, when you go into a lockdown mode or when you're in a barricaded mode, you don't come out for anything. And so they would hear things or they wouldn't hear things because they heard things so thoroughly that, you know, they had hidden so thoroughly that they didn't know that the drill was over. So we actually created a special subscription for this at the beginning of our disaster drill for them. They actually subscribe into a community engagement message, a notification, and we notify them when the drill has started, and then more importantly, we notify them when the drill has ended and when to return back. And our experience has been it makes it so much faster for us to conduct our drills now because we can get those people back out of their lockdown and barricaded mode back into the conference room because now they're receiving the all clear alert, just like they would in real life, that the scene is clear. And our final use case scenario under sort of the temporary event notification is helping to manage our media. So as a major tertiary care center and level 1 trauma center, we oftentimes have media that are showing up to cover a large event or some sort of newsworthy patient admission or event, such as, you know, December 2, we had a lot of news media. Anytime we have anything involving a hazardous materials event or something like that, a patient that's contaminated, we get a lot of news media showing up. And this will allow us to have our news media crews subscribe to this, and then we can inform them where our media briefings are going to occur and when they're going to occur. So that just helps us communicate with them in a way that allows us to relocate them to the right place at the right time. We actually originally anticipated using community engagement in a number of areas. Like I mentioned before, we're undergoing a major campus transformation project, and we're anticipating thousands of construction workers on our campus within the next 3 to 6 months here. And we had actually looked at using community engagement to notify our construction workers if we had an emergency or disaster on campus. But in working with our safety officers from our contractors, we discovered that they actually they don't allow their workers, their construction workers, to carry personal communication devices like a cell phone, because if they're up on the tower setting I-beams in place, they don't want them receiving phone calls or having to check their text messages when their undivided attention needs to be for the safety of the environment that they're working in. And so we've actually pulled back from that in terms of using community engagement for our construction workers, but rather we're actually enrolling those safety officers and foremen into our actual Everbridge system, and so they will be among the first to get the full messages that we're sending out as well, and then they have their own protocol and policy for notifying their construction workers. and that involves an air horn sound that goes off. There's a very large siren that they sound if there's an emergency or disaster. And also originally we were looking at utilizing this with our patients and visitors within the inpatient setting, but in talking with our clinicians, we recognized, or they brought to our attention, that they didn't want patients and visitors in the inpatient setting notified of disasters through the community engagement tool, primarily because when we look at sending out a notification, we typically will send out instructions on what we need you to do and some background about what has happened, what we're doing, and then again reiterating what we want them to do. And inpatients, because of their condition, don't have the ability to take those protective actions, and so it would simply increase the patient anxiety without allowing them to really have any useful information. So in this special case and situation, we actually are relying now on our clinical providers who get their notifications through Alertus, and for those managers and others and physicians who get their notifications through their personal devices, we'll be able then to communicate the specific protective actions that we want our patients to undertake. And then finally, students are also a non-use situation, and I'll explain that later in the return on investment slide. So like I mentioned before, we're actually actively in the phases of implementation for community engagement here. We are actually right there. We've just finished up item number 5. So as we work through our implementation phases, just know that some of this is history and some of this is yet to happen. We actually have a mass communication task force. It's a multidisciplinary committee that meets monthly, and we have representation from emergency management, from security, from our information systems at multiple levels, everything from our computer workstations to our telecommunications and central network services director. We have a lot of different representation from the technology side as well as the operational side on that. And we met with that group to discuss the potential audiences for community engagement and sort of identified our use case early on. And this was both part of the evaluation of the actual selection of Everbridge and community engagement as part of our communication solution and strategy, as well as the ongoing discussion about which audiences have migrated in or out of our strategy. We've set up our community engagement notification subscriptions. So these are things that are set up in the settings platform for Everbridge under our notification settings for our organization. And then we've also set up notification templates with pre-scripted messages that go out to those who've subscribed to our community engagement notifications. And that's some of what I'll be demonstrating later today when we get to the demonstration component. Another important component for our phases of implementation was to actually train our Security Control Center officers on incorporating community engagement alerts into our outgoing messages. They're pretty adept at sending out our standard Everbridge notification messages, which also go to Alertus, because that's something they do on a more regular basis. But one of the things that is part of the front-end interface for Everbridge is you don't have to send a community engagement message. It's an additional field. So they have to fill out any additional information that they want to go there. Now, it certainly is possible to copy the main message down into the community engagement text box, but in certain situations, you can't do that because there's a character limit, or we don't want to send out the same message to the public as we do to our own constituents. We also met with our marketing and public relations team to review our target audiences and ways of promoting our subscriptions. So we've met with them, and one of the challenges that any probably large organization has is that there's sometimes a backlog for services from departments that have a lot of workflow, and that was the case with our marketing and public relations team. And honestly, if I were to do this over again, I'd actually move that up to probably number 2 or 3 in our phases for implementation, because we ended up with a wait time on developing our marketing materials. So we're actually still a few weeks out from having those promotion materials published and available to us to use. And our final step then is to track the number of subscribers weekly so we can graph the results and look at which marketing campaigns that we're utilizing are most effective. So we have some different subscriptions that we have, and as we market each of the different ones, we'll actually be tracking the numbers and watching who signs up for those. Just trying to get my screen to advance here. Okay, our strategy for community engagement in terms of our marketing, again, it comes back to identifying our target audiences and understanding why we want to communicate with them and also what message we will deliver. So that helped to drive some of the marketing materials for that. But one of the key tools that we will be using are these little cards. These are actually the size of business cards. And in addition to our flyers and our electronic marketing campaign, we'll actually be handing out these business cards. On one side, it has these instructions here, and that basically it just is a short invitation to subscribe to the community engagement alert. On the back side, we have our logo and we have our email address on the back side. So if they have questions, if they want to learn more, they have a point of contact. And we actually have a website as well that we just developed in the last month for our LLUH alerts, and we'll be putting that on there as well, so we can direct people for more information on our community engagement tool. One of the other things that we learned, and fortunately we did this for the most part because of our mass communication task force being interdisciplinary, but we did learn a few things, a few other individuals that we probably should have involved earlier in this process. We certainly involved administration, we involved our security and safety officers and our marketing team, but we brought our patient care providers into this conversation a little bit late into the game, and that's when we realized that it wasn't, that inpatients were not a primary audience that we wanted to alert. And that would have been nice going in, and so, you know, always make sure if you're a healthcare facility to have some representatives from the actual patient care level. And the same thing for those of you who are universities, involve some students and faculty and staff in the initial discussion, just because it gives you just a different point of reference. And then finally, in our community engagement marketing plan, we want to provide a point of contact. Like I said, we use an email address that goes to a team of people that can answer those questions. And also, I didn't include our website here that people can go to for frequently asked questions that we can post there. So in terms of our best practices that we've developed so far for use of community engagement, one of those is to customize the message to the audience. Community engagement is sort of an interesting tool because it is an open subscription and you really don't know who's on the other end. So we need to actually always remember that it's an undefined audience and that anything that you post or you publish to community engagement is essentially a public notification that could be read by anybody or seen by anybody. So just assume that you're essentially publishing this to social media or to your website. To help make sure that we send out consistent messages or messages that are well scripted and well written, we're utilizing notification templates for some of the key notifications that would go out to our community engagement audience. And that helps to reduce the variability of one dispatch officer versus another typing up a message. So just from a reliability standpoint, we want to try to reduce the variation in terms of the quality of messages that come out. And just using those notification templates is a great way of eliminating that. In our community engagement, we've set our notification templates up to refer to additional resources and communication channels. The text messages that go out are limited to 138 characters. And so that really does limit the amount of information that we can provide, but we can provide a hyperlink in that and refer people to our website, our blog, where we have updated information on disaster conditions, and also our phone number that we use as an outgoing message only for sharing additional information for disaster conditions. If we're utilizing the community engagement tool for a temporary group, such as our disaster exercise or drill groups, it's just important for us to make sure that we purge the temporary notification groups, so that way the group that we trained last week isn't part of the notification for this week's training. And so that's just part of our standard operating protocol that we build in there to make sure that people, our users are going back in and we're resetting the tool in community engagement each time. And finally, the same principles of good risk communication apply to our community engagement as they do to Everbridge. I won't lie, we've had some communications that have come out of our organization that have been a little challenging, a little lacking in terms of clarity, and we've generated sometimes more questions than answers when we've sent out mass notifications to over 20,000 people. And so we've employed what we call our good risk communication principle checklist, and our messages always start out with what you need to do, and then we go into what has happened, what we are doing as an institution, and then we reaffirm what you need to do. And I'll actually be walking through that on the next slide here. But before we do that, I'd actually invite anyone who would like to participate in the demonstration to go ahead and sign up for the community engagement alert. And to do that, you just have to open up your text message app on your phone and type in the phone number 888-777. And then in the field, what you'll do is you'll type in LLUH web. Now, I have it in all caps here. It doesn't matter. You can type it in lowercase or uppercase or a combination of both, as long as it's all one string of characters there, all one word, LLUH web. You will be subscribed into this demonstration. And then you'll get a confirmation back, and you can actually set up a customized message, which is what we did, that will say, thanks for signing up for the community engagement webinar demo. And you'll receive that back once you've done this. And just so you know, we will delete and reset this when this webinar is over, so you won't continue to get notifications or alerts from Loma Linda University. So assuming everyone has set this up, I'm going to demonstrate what we have done. We've actually set up a template in our notification system, and we've already pre-scripted the message. And you can see what the message looks like here from the front-end interface in Everbridge. And then you can also see what it looks like when you get that message. And so I am clicking send right now. And it has just gone out. So you'll get a sense of the approximate time it takes for these messages to push out through the system. As you're waiting to get that message, I'm going to continue on with our discussion here. I'd like to talk about evaluating the return on investment. So one of the things that Loma Linda University Health is very sensitive to is the value that's being offered for the services that we pay for, as well as how that affects our community. And for this, we really needed to look at what role community engagement plays on our campus and how it differs from mass notification. So we've actually differentiated it, and I just wanted to go over some of those things in terms of our use case scenario here. Mass notification works with a defined audience. Whether you're using Everbridge or another mass notification vendor, they typically always have a defined audience that you're looking at, and typically a defined group size, which is going to be limited by your contract. Whether you have 10,000 contacts or 25,000 contacts or 100,000 contacts, that's your defined group size. And then you will typically manage your enrollment in a mass notification system, and you'll be maintaining either with the mass notification service or on your own, and then importing that information into the vendor. It's a managed enrollment process. Again, we have a contracted number of contacts, which defines our group size. And by comparison, community engagement is an undefined audience. You don't really know who's on that side. You don't have a limitation on the number of people that are signing up for this. And it is open enrollment. Anybody can enroll or unenroll at any time. The way our contract is set up is we do have an unlimited number of contacts within our community engagement tool. But then it also only results in a single pathway of delivery, the text message delivery there. And it doesn't allow for confirmation of those messages. So Everbridge for us is an important solution for our employees because we want multiple pathways. We want redundancy, and we also need integration with, say, other features like desktop notifications. Our Everbridge account with our people who are managed works very well for ongoing communication, whereas community engagement can work for both ongoing communication as well as temporary notification, assuming that the people that you want in the system are enrolled in the system. We look at mass notification as a tool, a mechanism of private communication with a caveat. We recognize that we're sending it out to a defined audience, but that there's nothing that's going to stop that person from tweeting or posting on Facebook or Instagram or calling a friend or sharing that information with anybody else. So we don't really consider this private communication, but it is directed communication. We recognize that community engagement is public communication because we don't know who's on the other end. This is stuff that we are willing to post on the internet for anyone to consume. With our Everbridge system, we expect to provide support to those who are in our database, on our contact record list. With our community engagement side, we really don't have any expectation of providing a significant amount of support to those individuals. And I think the final component is, why do we need both? Well, they're unique products. Each one is a unique product, and for us, mass notification also comes with an audit trail, and that's really important for certain things, such as the Clery Act, where we have an obligation for immediate and timely notifications. We actually want to be able to, in a court of law, show what we sent out and when we sent that message to various people. So looking at our use case scenario for this, given the comparison here, community engagement actually allows us to reach an otherwise unreachable audience. And there are obviously key differences between mass notification for us and community engagement. We had to look also at the contract costs. For us, it's an additional feature in addition to our Everbridge contract. But then we balance that off with the support costs and the time and management costs associated with had we tried to adopt all of our community stakeholders into our mass notification system through Everbridge solely without using community engagement. And then finally, reliability of our goal, going back to our one message, our ability to evaluate the message that the senders are sending out. And that's something that comes back to our dispatch officers. In terms of our reliability, that's an internal process. Evaluating the message that the recipients get is a slightly different process. We can do the audits within our Everbridge mass notification system. The community engagement, it's more of a flexible sort of thing. It's about the perception and feedback and what we're getting back from our core audiences, whether they like it, whether they are enjoying, they value the information that they're getting through there. And again, does this drive down the inappropriate use of our essentially our on-campus 911 security control center phone calls to that department, as well as then looking at our compliance issues, such as with the Clery Act. So with that, I'm going to open it up to questions. I think Megan's going to jump back on. I anticipate there might be a few questions.
Thank you so much. That was great. And while I take back presentation, right, I just want to remind everyone that we do have a few questions that were submitted prior to the webinar. However, we'll also take questions now. And as a reminder, you can submit your questions by typing the question into the open text field in the questions panel, which is right on your screen. And you have to submit it to all panelists so we can actually see it. And we'll answer as many questions as time allows. Actually, you might have to actually submit it to all organizers. That probably would work better. And in the meantime, I'll start with one of the questions that was asked prior to the webinar. We actually this is really good. So I know that you said you're on you're still in the process of rolling the system out. You're on stage step 6 from your slide. And what obstacles do you see in the future with getting opt-ins into your system? And if you could suggest any specific tactics or activities that you're going to do to get more opt-ins, that would be great.
Sure. I mean, that's a great question. I mean, when you purchase a solution like community engagement, you want that return on investment. You want to know that you're actually getting the enrollment that will allow you to make a difference, that will allow you to communicate with that audience effectively. We actually don't anticipate a lot of pushback from the primary stakeholders on our campus, such as employees of Bank of America, the Barnes & Noble bookstore that's on our campus, the barber shop, and even the church members. We really don't anticipate that there's going to be a lot of difficulty with that. And that's primarily because we've already been approached by many of them saying, how are we going to know about an emergency or disaster that's affecting the campus? Can you notify us? Can you communicate with us? We really, really want this. We need this. And so community engagement for us, for those primary stakeholders, has not so much been about us marketing it to them, but this is about responding to that unmet need that they've brought to our attention. I think where it becomes a little bit more difficult is when we have sort of that transient population, whether these are the outpatients coming here for multiple visits or residents in our Ronald McDonald House or other entities. And this is really about an awareness component. Most people will start to realize the value. Most people want to know this day and age. You know, they want to be on the inside track when it comes to knowledge about things that are happening around them. We've sort of all gotten used to being in the know through social media. And so this is also one of those other things that we can post on our social media sites through our Twitter feed and our Facebook sites, promoting the community engagement subscription for those groups. We also have a community disaster fair that our emergency management team is hosting later on this year in April. And we anticipate 500 to 1,000 attendees from the community then. And we'll be making them aware of it. They may not be the primary audience where they are going to do it. But one of the things that I really like about community engagement is how easy it is to subscribe to it and get signed up. Unlike Everbridge or any mass notification system where you have to sign up and set up an account and configure your contact points, this is a lot simpler. You simply text a key phrase to that 888-777, and I actually have multiple subscriptions, both through the county and the city, as well as our organization. And so it's that same number that is used for all of these, and you can subscribe to or unsubscribe from any one of those using that number. And pretty much everyone now is familiar with how to send a text message. And so that's why we're creating, certainly the campaign to get them to sign up right then and there, but we're also providing that little business card size thing that they can put in their pocket or put in their wallet, take it home, share it with other people, or just because maybe they didn't want to deal with it right then, they'll take it with them and see it again later.
Great, that's awesome, thank you. We have another really great question from Mark. He's asking, as it relates to the media alerts that you were speaking to earlier, can you speak to the challenges of how and when you would use community engagement for that? Specifically, do you always prepare a public statement, or is this only in high-profile situations, or do they actually opt in for like regular updates from you guys?
Sure. This is one of the applications that is actually under development, and it's not that we're providing our press releases through community engagement because, again, you are limited to 138 characters. So this is a tool that we're using for our public information officers who essentially will be providing press releases. But let's say we have a large high-profile incident and we want to host our press release at a specific location on our campus. By getting our media teams to subscribe to this, we can say, look, we know you're going to be here for the next 12 hours, or we know you're going to be here for the next 48 hours. When we have a press release, or when we have a press conference, I should say, not a press release, but when we have a press conference, we'll notify you 15 minutes before and let you know the location and the time that we're doing that. So that way they can actually show up for that press conference. It will also allow us to help redirect them to the proper location for the press conference, because it's really hard to reach out. We're not going to sit down and get on the phone and call every single media channel that shows up to our campus. But this allows us for those, particularly for those long, sort of extended media engagements where we may be doing a press conference every hour or every few hours for the next 24 or 48 hours. It allows us then to engage with that audience and to let them know and inform them, you know, in 15 minutes we've got a press conference, please meet us on the north lawn at that time. And it will really help us get those people where they need to be at the right time.
Great, awesome. Okay, so we have a question from Lisa. She's saying, great information, first of all, and then she says her organization is very small. Would the system be, would community engagement be too large for a group of 75 to 100 people, in your opinion?
Well, I think this comes back to that sort of core question of what's the difference between a mass notification system and community engagement. And if you have a small organization with 75 to 100 people, it really depends on your use case scenario. You know, if these are your own employees, you might actually want a more robust solution that's offered through a mass notification system as opposed to community engagement. Because you may need to know that they have been notified. You may want multiple pathways for notification. So it's not really a replacement for mass notification, but it can oftentimes work in conjunction with that. Now, you may have a small company that has a lot of community partners. You know, so you know if you are a police department in a small town, you may only have 30 employees or 50 employees. But your city population is who your actual target is for community engagement, and you know you may have a subscription base of 10,000 people. You know, so it really depends on your use case scenario.
Great. Okay, I think we have time for one more question. You spoke about the implementation process of community engagement, and it's probably different for for every hospital or every higher ed institution. But from your standpoint, what was the most difficult part of implementing community engagement on Loma Linda?
You know, that's a great question. We're a fairly large organization. We also have a lot of different corporate entities under the LLUH or Loma Linda University Health umbrella. So I think probably the largest challenge to this was making sure that we checked in with all the appropriate stakeholders, that we gained and earned the trust and input from every constituent, every corporate entity within our system. It's like working for. It's like trying to coordinate multiple states, maybe, or you know, maybe you own 5 dogs. They all want to go in a different direction, you know, when you take them for a walk. And so, I think the most challenging part was to be able to line everything up for us to be able to do a successful rollout for community engagement. I think the other thing for me was having to learn to be patient. I mean, community engagement is actually an amazingly simple tool to implement and to roll out, but because we are a fairly large and bureaucratic organization, I had to be patient with the rollout process, and it has taken a lot longer for us to roll it out than I anticipated because of the number of people that I had to go through and get their support and buy-in for the next step in those phases. But as far as, you know, rolling it out for a community, a city, government, municipality, it's fairly streamlined because you won't have as many layers to go through in terms of getting it approved. Presumably, I don't work in government, so I can't say to some of the challenges that they would have in terms of the approval process. But definitely make sure you get your stakeholders lined up and give yourself ample time to roll it out, and just to be patient. It's not an overnight process, even though the solution itself is very simple and it works really easily.
That's awesome. Thank you. At this point, we did run out of time. There was a couple of other questions, particularly on the Clery Act. Walter, I'll make sure that I or somebody on my team reaches out to you specifically on the Clery Act. But I would love to thank you, Ehren. Thank you so much. It was such a great webinar. And to all our attendees, thanks for being so engaged and making this an interactive session. If you missed any part of the webinar, please look for an email with a link to the recording as well as the slides in the next coming days. And if you do have any additional questions, please feel free to reach out to the marketing alias or contact us here at Everbridge, and we will be certain to follow up on any questions. And thank you again for your participation, and we hope to see you online soon.